Good evening. My name is Meg Wheeler. I'm a candidate for State Senate in the Massachusetts Plymouth and Norfolk District, and I'm here tonight to give you a COVID-19 update. So I go live every single weeknight at 7:30 p.m. Eastern here to bring you the latest updates on this pandemic. So just to start off, as I always do, I want to give you an update on where we're at numbers-wise. So for the state of Massachusetts, we have now tested a total of 87,511 people. We have 16,790 positive cases at this point. So that was an increase of 1,588 cases today. Very sadly, our death toll has continued to increase. We're now at 433 people who have died from this virus. That was an additional 77 new deaths today. Now, while the numbers do continue to rise, and it is expected that we have not hit the worst of this pandemic here in Massachusetts yet, Governor Baker did say today that we as a state are seeing a less steep acceleration of cases than in places like China or Italy, which is promising and indicates that perhaps our efforts to stay at home and our social distancing is in fact working. Now, the governor warned that, again, we have not seen the worst of it yet. I've said this before, but they continue to estimate that the surge will hit us between April 10th, which is this weekend, and April 20th. Our hospitals are still overburdened. So it's imperative that we continue to adhere to the stay-at-home advisory, to wash our hands, to wear masks when we go out in public, and to practice social distancing when we do need to leave the house. Now, Governor Baker also announced that he's issuing an order to protect healthcare professionals from lawsuits in the event that they are sued because of difficult decisions they have to make in the treatment of COVID-19 patients. He's also going to file a bill with the legislature to provide additional liability protections to providers and to facilities. Now, the state has developed guidelines for which patients will have access to ventilators in the event that there is a shortage. I want to be very clear. There is not a shortage right now. The governor has not come out and said that there's a shortage. These guidelines were simply put into place in the event that the worst case does in fact happen. Now, these are gut-wrenching decisions, and the guidelines were created by a group of doctors and bioethicists from across the Commonwealth. They were also adopted from a set of guidelines developed at the University of Pittsburgh, and those guidelines were then adopted by the state of Pennsylvania. Now, the way this works is each patient would be given a priority score from 1 through 8 based on the likelihood that they would survive discharge from the hospital, as well as the likelihood of long-term survival. Preference would be given to medical personnel as well as younger patients. And again, I do want to stress that these guidelines are not in place right now. These are only in the event that there is a shortage of ventilators. Currently, there is not a shortage. The state has asked for more ventilators from the federal government in anticipation of the surge that we're expecting. We've asked for over 1,000 ventilators. I believe it's 1,400. We've received at this point only 100, but nonetheless, we have not had an instance yet where these guidelines have had to be put into place. So this is simply so that we have something in place in case the worst does in fact happen. Now, the state also announced today that they are starting to publicly disclose data on the race and identity of patients with COVID-19. This is after criticism that there wasn't enough data and concerns that while the virus in itself does not discriminate, that just nationwide we are seeing communities of color being harder hit and facing worse treatment from this virus. So as we get more of this data from the state, we will of course bring that to you here. Now, a few legislative updates in Massachusetts. So some additional COVID-19 legislation. I mentioned this just briefly a few minutes ago, but Governor Baker is expected to file legislation in the State House to extend liability protection to healthcare workers during this pandemic. This addresses a fear that a lot of frontline medical personnel have had over being asked to work in abnormal conditions, being sort of asked to push the limits, if you will, of what would normally be allowed. This legislation would be aimed to protect healthcare professionals working in unique settings from medical malpractice lawsuits. The Massachusetts Nurses Association released a letter today to Governor Baker that outlines their legislative priorities in order to protect nurses and other licensed healthcare professionals, as well as volunteers and the new medical school graduates who you may have heard have been released early in order to help on the front lines. Now, the MNA, the Massachusetts Nurses Association, also said that Rep. Garlick, who is a registered nurse, will file legislation to give medical professionals immunity from civil liability for any injury or death alleged to have been sustained directly as a result of an act or omission by such medical professional in the course of providing medical services as part of this COVID-19 outbreak, unless, of course, it is established that that injury or death was caused by gross negligence or by the medical professional. So it really is going to enable our medical workers to continue to do the difficult work that they're doing without that fear that because they're operating under these just incredible circumstances, that they will be facing civil liabilities. Now, the frontline healthcare workers are expecting a surge, as has been reported for the last many days coming up, and a group of over 900 doctors, nurses, physicians, assistants, and other caregivers are issuing another plea for help to Governor Baker. So they have signed and are sending a second petition to the governor demanding more help. The first petition was sent 2 weeks ago. It warned the governor that the hospitals were on the verge of collapse. This petition lists 12 new demands, among them to further limit the list of essential businesses, to stop construction, to close gardening stores, to halt landscaping operations, and to issue a tighter stay-at-home advisory. They want to ban gatherings of any size in public. I will say that I am 100% in support of the demands that were outlined in this petition. I think they are things that we have been calling for here, that I have been calling for as well, and they are absolutely things that I support and believe need to happen in order to flatten the curve and prevent any further spread or deaths. Now, the state also imposed new limits on grocery stores Tuesday, saying they must not exceed 40% of allowed capacity at any given time. So you may notice this as you start to go to the grocery store, that there will be increased wait times and fewer people allowed in at once. As part of this petition by the medical professionals, it also is asking the governor to allow hospitals to allow staff to bring in their own protective equipment to work, including masks, including face shields, including full body suits, because that is, of course, one of the biggest concerns and one of the biggest issues we're seeing right now in hospitals is that there's just not enough PPE, personal protective equipment, for all of our medical professionals. They also want the governor to offer incentives to manufacturers that can ramp up production of this protective gear, again, including items like the full body suits. That's not currently part of the standard protective gear kits, but they want that included. Now, Governor Baker has already responded to one piece of this request, which is the medical malpractice legislation that he intends to file. We will certainly await to see if he responds to the other demands that are part of this letter. On the federal level, this is actually the second day that we're hearing encouraging signs. So Johns Hopkins changed the trending status of the U.S.'s coronavirus cases to down, meaning they're trending down, because of changes in the 5-day moving average of new cases. So this doesn't mean that it doesn't mean that we don't have new cases. We are still seeing additional cases every day, but we're seeing fewer additional cases every day in terms of the trend. Now, researchers do say that the peak has yet to come. So this does not mean that we're anywhere near being out of the woods yet. Projections also suggest that the U.S. will reach its peak use of resources, which includes hospital beds and ventilators, this Saturday. Again, this is just an estimate. This is what they are anticipating, but this is why it's incredibly important that we continue to practice social distancing. We continue to respect the stay-at-home advisory that is in place. Now, the modeling also shows that fewer people will likely die of the virus than originally thought, which is, of course, good news. But again, none of this means that we should take this any less seriously, or that we should stop taking the measures that we have been taking to stop the spread of this virus. In additional federal notes today, so there was a request for additional stimulus funding. We mentioned this briefly on the update yesterday. The White House has requested an additional $251 billion for the SBA Payroll Protection Program, which is, of course, intended to help business owners maintain their levels of payroll before the virus, to maintain them through this virus so that fewer people need to be laid off. So the government has requested an additional $251 billion for this. They originally requested $349 billion. That was approved as part of last week's $2 trillion stimulus bill. So that would bring the total funding for this payroll protection program to $600 billion. It has not been approved yet. It is still a part of discussions. There are some other things that are being discussed as well in terms of additional funding for hospitals, medical professionals, as well as things around voting and elections coming up. So we'll see what happens, and we'll certainly bring you an update when that funding is either approved or not. One thing I did want to bring up that we haven't talked about so far in an update is the increase in coronavirus scams. So, excuse me, we have seen an increase in scams as a result of this virus. I did want to just offer some quick tips that the government put out today to prevent being a victim of a scam. So the first is to ignore any offers for vaccinations and at-home test kits. There are currently no at-home test kits that are available that actually work. Similarly, there are no vaccinations yet at this point that work. So if someone offers you a vaccination or an at-home test kit, it is a scam. The second is to hang up on robocalls. Scammers use these robocalls to get your information and your money. So these robocalls are disguised as sales calls, but they are not in fact that. The third is to watch out for phishing emails or text messages. So these would be emails or texts with links in them. Do not click on these links unless you know who sent this message. And you've confirmed that this is a legitimate message, because this is another one of the ways that people are conducting scams right now. And then lastly, especially as many of us are trying to reach out and support our communities and are donating, research who you're donating to before you make that donation. Excuse me, there are a lot of charity scams popping up right now. So make sure it's a legitimate organization before you donate to them. Make sure that you're donating on their website and not through a link that's been emailed, through you. So make sure the donation is going to the right place. So that's the extent of our update for tonight. We've got one question, not a political question, but what is your favorite TV show to binge watch during this epidemic? It's actually a great question. So I'm a big political drama fan, but I've never actually seen West Wing from start to finish. So I did start that right about the time that we went into quarantine, into the stay-at-home advisory, and I'm almost to the end. Of course, I know what happens because I've seen bits and pieces of it, but this is the first time I've sat down and watched it from start to finish. And it's actually really fascinating for anyone who hasn't watched West Wing. It's fascinating how much they predicted for some of the conversations that we're having now, conversations around Medicare for all, conversations around alternative forms of energy. It's really fascinating, some of the stuff that they were talking about then that I think at that time probably seemed very much out of this world and unlikely to ever get any traction, that now are truly a part of our political conversation. So that's been my favorite. But again, I'm a political drama junkie. I know some other dramas that people have been enjoying. Certainly this tiger thing seems to be the big thing. I will admit I have not seen it. I probably will not watch it. It does not feel like my kind of thing. But, I said the same thing about The Office or Schitt's Creek or some other ones, and I ended up watching those and loving those. So you never know, but that seems to be the big thing right now. So thank you for the lighthearted question. I hope if you are staying at home and are able to stay at home, that you are finding ways to stay sane, to stay mentally healthy, physically healthy, and that you are taking good care of yourself. For everyone who does have to be out there, whether you are a medical worker, a doctor, a nurse, you work in our hospitals or our medical centers, if you are a police officer or fire, in the fire department, if you are working in our school system to ensure that our kids get the education they need, if you are working in our towns to make sure that our towns keep running, especially as we're going through our own budget seasons, if you are in the grocery stores or the pharmacies or the restaurants or the gas stations or in trucking, bringing us all of the resources we need. Just thank you to everyone who is out there on the front lines, working so incredibly hard and putting yourselves at risk and taking a lot of sacrifices, not just obviously the physical ones, but also just being away from your families and working overtime and working incredibly hard to ensure that the rest of us can stay home, can stay healthy, and so that we can truly stop the spread of this. So just thank you for that. You all truly are heroes, and you deserve a lot more than what you're getting. And I'm just incredibly grateful for everything you're doing. So I'm going to wrap it up there. As always, do not forget, if you want to help, the Red Cross is still looking for people to donate blood. You can make an appointment by going to redcross.org. You may have to wait a couple of weeks for an appointment, but still make one. They will definitely need blood supplies in a few weeks as well as now. And then we do have a COVID-19 resource page, megwheeler.com/COVID. We are continuing to update that every single day. We're adding more and more resources to that. So please do check that out if there's anything at all that you need. And of course, if you have any questions at all, or we can support you in any way, please do not hesitate to reach out to myself or my team. You can get us at hello@megwheeler.com. Of course, on our website, megwheeler.com/COVID. Or by calling our campaign phone, 781-724-3461. So I'll be back here again tomorrow night at 7:30 p.m. And in the meantime, I just hope everyone stays safe and healthy. And if there's anything at all that you need, we are here for you.